Hello, my name's Dr. Sarah Jarvis and I'm a family GP. I'm often faced in my surgery with parents frantic because their children are suffering from the dreaded chickenpox. In fact, 9 out of 10 kids in the UK will catch chickenpox, so it's not so much a question of if, but when. Although complications from chickenpox are rare, it's still an illness that should be treated with respect. So in this video, we're going to give you tips on how to diagnose and manage chickenpox, and our 10 golden rules. Look out for a blistered rash. If your child's been a bit irritable and has had a fever and then comes up with a blistering rash, chances are they do have chickenpox. The blisters are quite distinctive. They're little fluid-filled lumps with some redness of the skin underneath. They look a bit like raindrops on a rose petal. Now typically, the blisters appear first on the torso, on the body. The number of blisters will vary enormously from child to child, and they classically can come up from 3 to 5 days, but it can be 7. Some children get just a few, others are covered from head to toe. If you're confident your child has chickenpox, it's best to phone your pharmacist for advice. I always advise parents, if they can, to avoid bringing their children into the practice so that they don't come into contact with adults. If adults get chickenpox, it can get serious. If you are going to bring them into the practice, make sure you telephone first for advice. Give your child plenty of water to keep them hydrated. They will be losing more fluid than usual if they've got a fever. If your child's itchy and irritable, try giving them a lukewarm bath to soothe it down. Chickenpox can cause increased temperature in your child. It normally settles after 3 or 4 days, and infant paracetamol will help to bring the temperature down. But if their fever's above about 39 degrees and stays that way, do seek medical help. Make sure to try and minimise scratching. Research has shown that 43% of children end up with some scars because of scratching. Keep their fingernails really short and try and get them to wear cotton mittens at night because they can scratch in their sleep. While calamine lotion offers a momentary cooling effect, as the liquid evaporates from the skin, it can dry it out, and that can actually make the itching worse. Try a clinically proven cooling gel or spray. Dress your child in light cotton clothing. Smooth cotton is ideal to prevent irritation. Kids can get really itchy when they have chickenpox. An antihistamine which has a drowsy effect can help with this. Speak to your pharmacist for advice. It's normal for them to have a fever at the start of the illness, but that usually settles after 3 or 4 days. But it's also normal for more spots to keep occurring for 3 to 5, sometimes up to 7 days. So in summary, here are our 10 golden rules for making managing chickenpox easy. Look out for a blistered rash. If your child has chickenpox, ring your pharmacist. Don't take your child to the doctor's surgery unless you're concerned. Give your child plenty of fluid to keep them hydrated. Think about giving them a lukewarm bath. Give them infant paracetamol to reduce fever and manage pain. Minimise scratching by cutting fingernails. Use a cooling gel or spray to soothe skin. Dress your child in light, loose clothing. Give them a drowsy-making antihistamine. If symptoms are improving after 5 to 7 days but then there's a relapse, parents should seek medical help straight away. Obviously, if they have a convulsion, it's a medical emergency, but that is rare. If your child gets any of those complications though, do seek medical help urgently.